are at the NMC Specialty Hospital, and we continue with the surgical insights. We're here with Dr. Sanjay, and we're going to be talking about ENT health and his specialty. Doctor, tell us what got you inspired to be an ENT specialist.
Thank you for hosting me today. Regarding the ENT, my childhood, I have suffered a lot of ENT issues. I was having nose problem, I was having throat problem. So anyhow, I was a bit attracted towards this branch of science, like something which is hidden, which is not exposed, like you don't have to see, like you cannot see, you have to go inside, deep inside to see into the ear, into the nose, into the throat. So that was the cause I said, okay, I should opt for this branch because, I had suffered myself a lot about these issues.
Perfect. Okay, so since you're such a specialist and this is from your own experience, let's help the people who live in the UAE.
Yes.
Because here, because of the climate, we have the dust, we have the weather, we have the humidity, there's a lot of issues, right? What are some of the most common issues you see here in the ENT of the right?
I think we should broadly classify them into, of course, the ear, nose and throat. Ear, what mainly we see here is because most of the time we have summers here, and a lot of people go for the swimming, for the diving into the seas.
Oh, yeah.
So these issues, we do see a lot of patients, mainly in the summers, who regularly go for swimming, they have ear issues. Some of them, they have fungal infections. Some of them, they have the wax, which swells up because of the water. Some of them, suddenly they develop, I had a patient who had gone to the sea for swimming, and he had a lot of sand that went into his ear, and, it was very difficult for him till I removed that sand. So again, ear, the issues due to water, you can say. Then here, the weather being very hot and dry, humidity causes a lot of itching and irritation of the skin because of the dryness of the skin, because of the dry weather. The ear, as you know, it is made up of external ear, middle ear and inner ear. External ear is the skin which is exposed to the exterior, which is in direct contact with the exterior. Any temperature changes directly affects the ear skin also. So any dryness causes dryness in the ear also. We do have a lot of patients, they use the earbuds to itch the ear, and then again, they fall into a trap. Using the earbuds, it is never advisable. In fact, using the earbuds, you're causing more trouble for yourself. You're pushing the wax more inside. You're abrating the skin of the external auditory canal, on which if any water goes in, gives rise to fungal infection. So again, the climate plays a big role in the ear issues. Regarding the nose, of course, here, the dust is very common, sandstorms are very common. We are used to using the air conditioning units, I should say 7 to 8 months in a year. So sand, dust storms, they do prone to various allergies. Various allergies give rise to various sinus issues. And so you have to be careful about all these things.
Okay.
And regarding the throat, again, because of the dry weather and low humidity, you suffer more of dry throat. If you are not properly hydrated, can give rise to throat issues, discomfort in the throat. So weather plays an important role in ear, nose and throat hygiene. Here, I would like to add something more, that here, most of the people, they do take frequent flights. So the taken flights again can give rise to air pressure changes, can give rise to ear issues, which can give rise to issues in hearing, severe pain. We do get a lot of patients, especially when the school season starts, the patient, they travel a lot. So in recent days, I've seen a lot of parents, kids coming, they're having issues because of the flights.
Okay.
They take the flight when they're having some infection in the nose or throat. So usually we suggest not to take flight in that situation, but they have to take the flight, leading to ear infections, severe ear pain, and in extreme conditions can give rise to eardrum rupture also.
Okay, so perfect. I love that you talk about all these topics because now we can help the people maybe prevent them.
Yes.
Okay, so let's start there. Let's start with ear hygiene or ear care. What will be some of the steps you suggest to people to take care of their ears to prevent some of these issues you speak about, or something that they can do before or during the flight?
So first of all, please don't play with the ear.
Okay.
No earbuds, no keys, no using fingers to scratch the ears.
Okay.
Keep away from it because they are going to cause more problems to you than solving your problems.
Okay.
Second, in case if you're having any cold, any cough, or any issues of ear, nose and throat, try to avoid flying. But then if you have to fly, just carry some decongestant nasal drops with you, which you can use at the time of ascent and descent of the flight, because that will help you to equalize the pressure between the ear and the nose, and that can avoid a lot of issues.
That's amazing.
There is a tube that connects nose to the ear. We call it as an eustachian tube. So this tube equalizes the pressure when the flights go up and the flights go down. But because of the congestion, when the congestion is there, let us say the nose congestion, this tube doesn't work properly, and then it gives rise to issues in the ear. So if any issues of the nose, better to carry a decongestant spray with you, to use the spray at the time of ascent and descent of the flight. That can avoid a lot of issues.
Okay, those are great tips. Now let's stay with the nose. Sinus, I think, is a big issue here. You hear a lot of people who talk about sinus issues and things like that.
I should say ENT survive here on the basis of sinus only.
Ah, okay.
So basically sinuses, these are the air-filled cavities which has been made by God to make the weight of the skull as light as possible. Because if God would have made the skull heavy, that would have been difficult for him to, stable that skull on rest of the body.
Okay.
So these are the air-filled cavities which has been made by the God to make the weight of the skull as light as possible. These air cavities, again, they're connected to the nose, and nose is connected to the exterior.
Correct.
Because of allergies and these sinuses, they drain all the secretions into the nose, and in situations in which the allergies are too much, these sinuses start producing a lot of secretions, in which you must have a lot of people saying that we are having a lot of phlegm, we are throwing a lot of phlegm, we are throwing a lot of phlegm. Some people say we have post-nasal drip. So in the normal situation, if normal amount of secretions are being made by the nose and the sinuses, usually you throw it out through the oral cavity or through the nose. But in case if the amount is too much, then it starts trickling down to your throat. It can give rise to cough also, which in the layman language sometimes we call it as post-nasal drip. So allergies and sinuses, and then if the sinus issue, the allergy issues, if they're not taken care at the right time, can block the sinuses. Blocking the drainage of the sinuses leads to stagnation of the fluid in the sinuses, which give rise to infection, which is what we call as sinusitis. That can give rise to nose block, that can give rise to facial pain, that can give rise to loss of smell, that can give rise to chronic headache. Basically, discomfort, quality of life become very, very bad with the sinus issue.
Okay, and how the patient will know the difference sometimes between a really sinus infection instead of just common allergies? How would they know what the difference?
Common allergies can only be, you can have some sneezing, you can have some itching in the eyes, you can have some runny nose. But if to begin with as an allergy, and if not taken care properly, as I told you, can block the exit routes of the sinuses, and then the secretions get stagnated. You can have infection, you can have fever, headache, loss of smell, facial pain, and overall you won't feel comfortable.
Okay, good to know. Doctor, and now let's stay with the nose, because obviously this is a very interesting topic. I think we take it for granted, like you say. A lot of people use the irrigation where they pour the liquids about it. Tell us how useful that is, how safe it is, and is actually recommended.
Basically I'd like to highlight a thing. In the Indian system of medicine, in Ayurveda, there is a ritual, we call it as a jal neti.
Okay.
In gel neti, there is a special, a cup-like thing in which we pour the water, and we pour the water from one nostril, it comes out from the other.
Correct, yeah.
So basically, the principle is same. It is for the rinsing of the nose. We want any allergies who have stuck to the nose, causing issues of allergies and blocked nose, just to raise them, just to cleanse them. We can use the water for the irrigation. And now we have a lot of salt water sprays available here in the pharmacies, which we do very commonly recommend to patients in UAE to use them, just to rinse the nose and just to moist the nose, because the temperature, as I told you, is very high, which gives rise to dryness of the nose, can give rise to crusting, sometimes can give rise to bleeding from the nose.
Okay.
So these salt water sprays, they do help you in cleansing the nose, in opening the blocked nose, and just to breathe properly. So if they safely use and properly use, they're actually a good.
They're very helpful. Very.
Okay. And something that you mentioned during the answer is nosebleeds, right? Which is happen often here. I've seen a lot of people with nosebleeds. Explain us why this happened and what are the first things that people should do? Because it's here, pull your head up or just stop. Tell us how we treat it.
The bleeding from the nose, in the layman term and in the medical term, we term it as an epistaxis. So nose, it is the most vascular part of the body. Nose is having a lot of blood vessels, which are very, very tiny and very fragile. Okay. So any external issues like, hot weather, or sometimes some kids, they have habit of picking the nose. So hot weather can cause dryness of the nose, and especially the vessels, they come and there is a confluence of vessels at the anterior part of the nose. We call it as a Little's area. So this area, it is prone to bleed because of direct exposure to the external changes in the environment, to the weather. And some kids with the finger, when they try to pick the nose, they directly hit the Little's area and they start to bleed.
Okay.
So if bleeding, it is something which is related to the weather, or you don't have any other underlying issues. Like some people have kidney issues, liver issues, some people have issues with the blood clotting. In those situations, bleeding from the nose is something very serious. You have to take it, you should be concerned about it. But in a normal person, healthy person, any bleeding, the most common cause is, of course, the dehydration, dryness. In that situation, just don't get panicked, sit straight, pinch your nostril with the thumb and the index finger, and just open the mouth and breathe. There's no point in lying down, because lying down, again, blood will trickle out your throat, it'll go into your airway, or it'll go into your stomach. If it goes into your stomach, can give rise to vomiting. If it goes into your airway, that can cause breathing difficulty. So the best thing is sit straight, pinch your nostril. Within 2 to 3 minutes, any normal bleeding has to stop.
Okay.
If it doesn't stop within 2 to 3 minutes on its own, then yes, it is a red flag sign.
Okay, they need to come and see you for sure.
Yeah.
Okay, so we talk about the ears, we talk about the nose. Now let's talk about the throat, right? And especially there's something here called Dubai throat, because a lot of people, when they speak a lot, I would say maybe if they change the temperatures, you go from very hot to very cold ACs. Tell us about how can people take care of their throat in this case?
Yeah, so we do have a lot of patients, especially the teachers, people who are working at call centers, they do come to us with what you call Dubai throat. So these are the professions, like we said, the lawyers, the preachers, and the teachers, who have to use the voice a lot.
Right.
They have to be careful about their voice also. And usually with the changes of temperature, once you are into like we are into an AC room, then going out it is hot. It changes the vessels which are there in the throat. Sometimes they become constricted and they get congested. Then you have issues of congestion of the throat. So basically, you should avoid any extreme changes of the temperature.
Okay.
Keep yourself hydrated. Try to have some gap in between the long talks, and just to be sure not to go at a very high pitch.
Okay.
So these are the precautions that you can take, and that will keep your voice
going. Yes.
Yeah.
And if you correct me if I'm wrong, and we're talking about hydration, we think and we recommend room temperature water or room temperature drinks instead of hot or cold, correct?
Correct. Room temperature is the best. It shouldn't be cold, it shouldn't be hot. At the most lukewarm case.
Okay, perfect. Doctor, you've been in this field for a while. So now let's talk about the advances and the technology that now you have available today. How does have changed the practice for you when you come and see the patients?
It has changed a lot. See, for me, I am in UAE since last 25 years. To begin with, I started in the government sector. I have a good exposure working in Ministry of Health. Then I switched on to the private sector, and things have changed manifold. So especially if you see the surgical procedures, now one of the commonest procedures that we do in ENT is tonsils and adenoids. So tonsillectomy in the olden times, especially even for the pediatric or the adult age group, it used to be a dreadful surgery. Now also I get patients, they say, Dr. tonsillectomy, oh my God, my uncle had done it so many years back, and for 5 days he couldn't get up from the bed, he was not able to eat or drink, he was in severe pain. But now things have changed tremendously.
Amen.
Now we have instruments like we have a gallbladder now, which releases the energy from the tip. And this gallbladder helps us in doing the tonsillectomy. Hardly takes 15 minutes. And you won't believe, second day, the kids, they are ready to go to school. Hardly there's any pain. And one of the dreadful complications of tonsillectomy surgery used to be the bleeding, the post-operative bleeding. But with the gallbladder, when we do intracapsular tonsillectomy, there are nil chances of bleeding, nil chances of pain. Second, third day, whether it is an adult or it's a child, they're fit to resume the normal duties.
Amazing.
Then we have debriders. We have, a lot of to do the complicated surgery in which the disease are extending from the sinuses to the brain. We have so many instruments which help us to avoid the complications.
Is there any of these instruments that are new to you and to the practice that are your favorite? That every time you see it, you're like, I'm so grateful that this exists now.
I should say gallbladder, because tonsillectomy is bread and butter for ENT.
Yeah.
So every month, a lot of surgeries I'm doing. So Coblet is one of the best instrument which has come to use in these days.
Perfect. And Isabello here in the NMC, correct?
Yes.
Yeah, you guys have an amazing equipment. Okay, so just to finish this conversation before I get to know you better, any other tips that you want to give to the UAE residents in order to maintain a good ENT health?
Yeah, as I told you, don't play with the air. Secondly, avoid the smoke, especially smoking, very rampant here. If you're having any throat issues, try not to smoke, whether it is a first-hand smoke or a second-hand smoke. Try to be in an environment which is a smoke-free, because smoke, again, if you inhale, can cause a lot of throat issues.
Correct.
And then regarding the nose, as I said, have plenty of fluids, keep yourself hydrated. If any issues of the nose, use a salt water spray. That helps you a lot to avoid the sinus issues, the allergy issues.
Doctor, if a child is snoring constantly, what parents should do and when is the right time for them to come and see you?
Yeah, of course, the snoring is very common in the age group of 4 to 8 years mainly. And the most common cause in this age group is enlarged adenoids. So along with the enlarged adenoids, some of the kids, they also have hearing loss issues because of the fluid getting accumulated at the back of the eardrum. So kids with big adenoids, they cannot sleep in the night, so daytime they're lethargic. And sometimes from the school, the complaint comes that the child is not attentive in the class. When these kids are being brought further to us for evaluation, they have been diagnosed as what we call as a secretory otitis media or fluid at the back of the eardrum. So in this situation, we have to go for the surgery of the adenoids, as well as we have to drain the fluid also, so that the hearing comes back to the normal. So the parents, they should be careful about the hearing of the child. Sometimes reverse happens, that the child has a reduced hearing, and then when we investigate, it comes out to be because of the increased adenoids, or sometimes because of the increased adenoids, the parents, they come to us, the child is not responding to the normal calls.
Okay, doctor, there's something that, I believe it was for older people, but I think affects people for all ages, and it becomes the ear, and it's called vertigo. Tell us how a person actually realizes they're not just dizzy and probably suffering from vertigo, and what it can be done about it.
See, vertigo, like if I see my OPD practice, if daily I'm seeing 30-35 patients in a day, so at least 5 to 6 of them are having vertigo. And regarding vertigo, a very misconception is there that this is something very serious, and few of the patients I got who have come to me in that state, that was the end for their life, I have seen patients who come to me crying and they're totally depressed. Doctor, I'm having dizziness. I don't know. The Google says I'm going to die. Blah, 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 blah. Basically, vertigo, the most common history is the patient says, Doctor, we were getting up from the bed and suddenly we started to feel that the room is spinning around. So again, a very quick regarding the ear. The ear is a balance as well as a hearing organ of the body. Especially the inner ear, it helps us in the balance also. Sometimes because of some unusual movement at the neck, the fluid disturbance takes place in the inner ear, which give rise to what we call as dizziness or vertigo.
Okay.
Until unless it is associated with other features like any weakening of the body, any disorientation, any fainting spells, you should not be worried about it. This is usually a self-limiting situation which within 5 to 7 days can come back to normal. But here, 5 to 7 days, you cannot take rest for the things to be normal. So you have to visit to the doctor who will advise some medicines which will bring things under control, and you will be back to normal with some exercises that will again help you to avoid any recurrence of the problem.
Amazing. So vertigo can be reversed.
100%.
Okay, and what would be good advice for people to avoid getting vertigo?
So as I said, any jerky neck movements should be avoided, which can precipitate vertigo.
Amazing. Thank you, doctor. I love all your tips and definitely will learn a lot.
Thank you.
Yes, thank you. Now we want to get to know you better. So when you go for the rapid questions, meaning that I'm going to ask you questions quite quickly and you're going to answer the first thing comes to your mind. Are you ready?
Yeah, ready.
Perfect. Doctor, one word that describes your approach to NNT care.
My approach is not only cure, but care. And care comes before.
I love it. Perfect. You must have item in Dubai clinic or an instrument that you can live without. I think we talked about it already.
Yeah, it's a Coblet.
Perfect. The most common myth about ENT problems that you don't want people to continue believing.
Basically, using up the earbuds,
Okay.
increase the air. No, they increase your problems.
I mean,
Should not be used.
I'm going to skip into it. What about the cotton swabs?
Nothing should be used. Like you
Right.
say, nothing should be put in the air. At the most, what we find is olive oil is best for the ear.
Olive oil. Love it.
That is this.
So how
And
should you use
just you can dip some cotton and just pour a few drops into the ear. That will keep the skin of the ear moist. That will remove the small amount of wax that gets accumulated. And the best is it doesn't cause any infection. Because in the Asian countries, there is a habit of using the mustard oil. Mustard oil it's not good because mustard oil is known to cause the fungal infections.
Okay.
Olive oil is very safe. I do advise my patients, any age group, it is the safest thing that you can put in there.
Okay, this is probably the greatest tip I heard about in a long time, doctor. Thank you so much. Okay, do you have a favorite time to treat your patients, either morning, afternoon, or evening?
Anytime.
Anytime. Perfect. The neti pot is a miracle tool or a hazard? The irrigation, then
That is good, should be used.
perfect. We already talked about cotton buds, sorry. Most unusual thing you ever remove from a nose or an ear?
Can you believe it? I had a patient who was working in Pizza Hut. So these two guys, they had a big fight and they threw pizzas on each other and I had to remove a lot of cheese from the ear from one of them.
I do not believe it, but I guess there's people out there doing the same. Oh my gosh, okay, this is a great story. On a scale 1 to 10, how worried should people be about snoring?
Snoring, if yes, it is affecting day-to-day activity of the person. Like daytime, he is lethargic, nighttime, he cannot sleep properly. And, overall it is affecting his performance, then yes, he should be worried about it. Because in the long run, again, snoring, if not properly taken care of, can cause a lot of other cardiovascular issues also.
Oh yeah, exactly. It would be a triple.
Arrhythmias and all, it has been proved, can be because of serious snoring.
Okay, good to know. And what is a favorite sound in the world for you? What's something that you like to listen to?
Any kind of music.
Amazing. Perfect. A favorite food or drink that you like at the end of the day to make you feel relaxed?
Water.
Water. Okay, very good. A single piece of home care device for families who have kids and they are prone to ENT issues. Something that parents should have at home in case that they have a child, they have recurring issues with ENT.
I should say nasal sprays.
Okay.
Saline nasal spray.
Saline nasal sprays, very free. Go-to remedy for a scratchy throat before a big presentation.
Saltwater gargling, yes. Can be tried at home.
Tell me again.
Saltwater gargling.
Okay, so water, Google, and
Yeah. It helps you a lot.
perfect. Tea or coffee, which one do you recommend more for throat health? Tea or coffee? Or either?
Either of them.
Okay, they're just pleasure.
Yeah.
Perfect. And one thing everyone should know to do daily with their ears, nose, and throat.
Fourth, you can do gargling as a routine habit. Like after brushing your teeth in the night, you can do some saltwater gargling. Nose, you can use a saline water spray. And regarding throat, try to avoid anything that hurts your throat.
Okay, and the ears, the olive oil, which is probably the most amazing tip.
That is the best.
Amazing. Doctor, thank you so much. It was very insightful to learn from you, so I appreciate your time with us today.
Thank you.
Amazing, thank you.